Andy Costello with Gary Petersen, the CEO of Rainier Springs. And we're here to talk a little bit about what Rainier Springs is and what's going on in the Vancouver community. So tell us a little bit about Rainier Springs.
Great. Well, thanks for giving us this opportunity. This is really fun. So we are very excited. Rainier Springs is a behavioral health hospital. We'll be opening on September 6th. We've got a big open house on September 5th. We'd like to see everybody come. 3:45 is our opening ceremony, followed by tours of the facility, so you can actually come in and see. But basically, we are offering inpatient and outpatient behavioral health services for both addiction and all different mental health diagnoses.
Wow, that's going to be something definitely our community is going to be able to benefit from. So you haven't opened yet, but tell us maybe a little bit, if you have any challenges that you've run into so far getting the facility up and running before your opening.
I don't think challenges. I think it's been great. I mean, it's a great community to partner with. I mean, we really feel like there's a need. We're not here to compete with anybody. We're trying to fill a gap. And so we're going to provide those intensive inpatient services for people that really need that additional structure in a very safe environment with the highest level of quality, laser focus on safety, in a very respectful environment to get people returning to their normal lives again. And so the challenges, I think it's just the usual stuff, just the timeline, getting people hired. We still, as we're ramping up, we're going to open with just one unit, but we will be growing into several more. And we're going to be needing more staff. We'd like to have more licensed Washington therapists. We're going to be needing more nursing staff and more other ancillary staff as we grow, but we'll open smaller and then grow.
That's great. Our community definitely will benefit from the jobs and what you're bringing to the community. So usually I ask people how they know they've been successful, but since you haven't opened yet, I guess projecting forward in your vision, how do you know that your facility will be successful in helping the community?
Well, we're very data driven. So we have several metrics that we follow. So we do use Basis 32. So basically when somebody comes into our program, which by the way, we have free assessments 24/7. Even on holidays, we will have staff here at the assessment front office. We have phone triage lines open so we can accommodate people. But when somebody is assessed to be appropriate for our facility, and then there's an initial assessment. It's a self-assessment, and then we do that again post-treatment. So it's a measurement based on their perception of how they're doing. We measure that. We measure patient satisfaction. We measure staff satisfaction. So those are some of the indicators that we look at. Also, we're really getting a read. We have a great community liaison team that are out there working with the community because we want to hear how are we doing in the community and what does the community need. We want to partner with the community. There's some great programs that are already here for IOP and PHP programs that we want to partner with very well so that we can work with them. So it's going to be a lot of things. It's going to be data driven, but it's also going to be our ears to the community.
That makes sense. So if you wanted to tell the community one thing about Rainier Springs, what would that be?
Well, I've worked in the industry, both in mental health and behavioral health, as well as acute medicine for a long time. I'm a lot older than you are. And this is one of the most beautiful and very respectful environments it's just incredible. Unfortunately, sometimes what happens is that when hospitals open new wings, and that's for your high-end services, intensive care, cardiac care, whatever, and then they'll save the older wings and they'll move behavioral health there, mental health there. And so some hospitals have that in a not very nice environment in the hospital. This is, there's all natural lighting. It's really beautiful. The setting is gorgeous. We're surrounded by the beautiful pine trees of this region. We've got Salmon Creek right behind us. We have incredible outdoor space for our patients as well. So it's a very respectful environment that also is well incorporated into the Great Northwest.
Yeah,
it's beautiful.
I definitely agree with that. Your facility is beautiful on the tour that I saw today. Yeah. So if you were to put a message on a billboard, because you're right next to 205,
sure.
About Rainier Springs, what would you want that billboard to say?
Well, it'd be hard to put it in a billboard, but it's if you're needing help, we're here. We're here 24/7, and unfortunately in the past there's been a lot of stigma around mental health and addiction services. But all of us are trained to be, we all are here because of our own story or family member story or loved one story. There is a passion that's behind, and so we're here to help. We're here to help you. We want everybody to get the help that they need and in the most respectful way possible. So. That's a lot. That's a lot on a billboard. I'm not a marketing person. I don't know. Put that all in a billboard. You've got to drive by in 60 seconds, right? I don't know what I would say. Maybe just like a big smile on the face. So, yeah.
If you need help.
If you need help.
Yeah.
Yeah.
So tell everybody where you're located since you're new to the community.
Sure. Well, we're in Salmon Creek. So we're very close to the WSU campus. We're located behind, right off of 134th Street and 27th. So kind of behind, there's a Holiday Inn Express there, WSU campus. We're fairly close to Legacy Salmon Creek, right off of the 205.
You're in an ideal location, easy to get to.
Exactly.
Yeah.
Exactly.
Well, Gary, thank you so much for your time.
Hey, thanks for coming out. Nice to meet you.
Nice to meet you. Take care.